Thank you very much for the opportunity to present today. As stated, I'll be presenting on decreased prescription costs associated with bariatric surgery, a cohort study done in Manitoba. We have no financial disclosures or other disclosures to state today. 7 seconds. So obesity has become a worldwide epidemic, having almost tripled in the last 50 years. In 2022, the WHO reported that 39% of adults globally were considered overweight and approximately 16 are reported as obese. Patients that suffer from obesity are also more likely to suffer from other metabolic syndromes, including things such as hypertension, adult onset diabetes, dyslipidemia, as well as increased cardiovascular disease risk. Along with these metabolic syndromes, they're also more likely to suffer from things such as osteoarthritis, obstructive sleep apnea, as well as chronic pain, just to name a few. Bariatric surgery has been described as one of the most effective treatments for severe obesity, as well as the obesity-related complications, as previously stated. Post-operatively, these patients have resolution of their metabolic syndromes in up to 70% of cases. We performed a single-center retrospective review of patients undergoing bariatric surgery at the Center of Metabolic and Bariatric Surgery in Manitoba, Canada. We collected data from 2013 to 2019 of all patients that were in the program itself. We did routine bariatric follow-up with these patients at 6 weeks, 6 months, then annually for 5 years post-operatively. From the Manitoba Center of Health Policy, we were able to then gather de-identified data related to their provincial health number, would allowed us to retrieve records from outpatient prescription dispensations from the Provincial Drug Program Information Network. We then summarized these at 1, 3, and 5 years, both pre- and post-operatively from their bariatric surgery, and then evaluated the total associative costs with these prescriptions themselves. We then adjusted for inflation over this study period so that we were looking at data cumulatively. Over the course of this 6-year period, 1,184 patients were enrolled in the program. The mean age was 46 with a mean BMI of 45.9 with a range to 31 to 59.4. Majority of our patients were female, with being approximately 86%, and majority of the procedures that were performed was a Roux-en-Y gastric bypass. Overall, this is the prescription numbers that were dispensed over our study period, looking at the 5 years pre-op to 5 years post-op. So you can see in all of the categories that we looked at, specifically for metabolic syndrome, so antihypertensive, insulin, lipid-lowering agents, as well as other diabetes medications, there was a trend for decrease that was at the lowest portion at the 1 year post-op, with a slight increase over the course of the 5 years from their surgery itself. We then looked at the cost of the prescription medications from 5 years pre-op to 5 years post-operatively, and that overall savings is looking at the 5 years pre-op to the 5 years post-op, knowing that there was a dip at that 1 year point, but looking at the 10-year period, all of these classifications of medications had a significant decrease in overall cost savings, ranging from $170,000 to $550,000, depending on the medication class. We compared different groups to see if there was going to be any significant changes in looking at males versus females for the decrease in medications, usage or costs themselves. And as you can see, because we did have a larger female population, there was more cost savings in the female class of medications. However, there was nothing of increased significance. We also looked at cost of medications based on age group to see if there's ages that are going to allow for an increased amount of cost savings. And we did see that in the older age grouping, there was slightly increased savings overall. And then looking at cost of medications based on their postal code to see if there was a trend for urban versus rural savings, which there was not. So overall, this is the first Canadian study that used provincial administrative prescription database to report accurate dispensing data looking at the long-term cost savings for metabolic syndromes associated prescriptions after bariatric surgery. Our results demonstrate a clear reduction in overall costs after bariatric surgery itself. In addition, we're able to demonstrate that this was seen across multiple medication classes after the bariatric surgery. We plan to do future studies to further delineate the overall cost savings for metabolic syndromes post the bariatric surgery, as well as include specifically the cost savings per person and also add the cost of the surgery itself to see what overall cost savings might be. Thank you very much, and I open the floor to questions.
Any questions?